Let's speak about golden ring, which we get after doing hydrodelineation in few cases, and what does it tell you. So you can see that this is a case of a posterior subcapsular cataract. I'm doing the regular incisions. I generally use 2.8 incision and the side port using MVR. And after filling the antechamber with OVD, I'm going to do capsulorhexis. The target size of capsulorhexis here is 5 millimeters, and try to center it around that Purkinje image. After that, I will be doing hydrodissection. So the first you can see the hydrodissection way going, and then I tap on the other sides to make sure that the fluid wave comes from the other end. And then I'm going into the substance of the nucleus and injecting more to check if the hydrodelineation is happening. And you can see here that there are multiple golden rings, and very small golden ring is there at the center. That indicates that there is a small endonucleus and it's a softer grade cataract. And then you can see that I pushed little bit of fluid further in the periphery, so that prolapsed out the nucleus. At least one pole is out, and now you can watch bevel of the phaco tip, which is sideways or towards the periphery of that endonucleus, and it just starts aspirating. I'm hardly using any phaco power. You can see the CD, or which is indicative of phaco energy, is hardly moving. So it's mainly phaco aspiration which is happening. So once you get that hydrodelineation and multiple golden rings and a small endonucleus, you can just use this technique. It's more efficient, it's safer, and you can finish the case quite quickly. Usually it takes just 3-4 minutes to finish the case in these with this technique. IL goes in there. This is a trifocal IOL, and these patients recover very fast because you have not used phaco energy at all. So cornea is crystal clear, even immediate post-operative, and patients are quite happy with this. So whenever you see this golden ring, so when do I try to do hydrodelineation? I try to do hydrodelineation when I have got this kind of very good red glow when with the cataract, so which indicates that probably the cataract might be softer. Secondly, when I do the first hydrodissection, I get the feel of that lens matter. If it feels softer, I go ahead with more hydrodelineation. I avoid it in cortical cataract because you tend not get that delineation quite often. Also, for hard cataract, there is no point in trying to do hydrodelineation. Thank you for watching, and do subscribe.